Lung infection, causes, symptoms, and prevention. What is a lung infection? A lung infection occurs when viruses, bacteria, or fungi infect the lungs, leading to inflammation and breathing issues. Common types include pneumonia, bronchitis, and tuberculosis. Common causes: bacterial infections, example Streptococcus pneumoniae. Viral infections, example influenza, RSV, COVID-19. Fungal infections, example Aspergillus, Histoplasma. Weakened immunity, chronic illness, HIV, etc. Aspiration, inhaling food, liquid, or vomit. Symptoms: cough, with or without mucus. Fever and chills. Chest pain or tightness. Shortness of breath. Fatigue or weakness. Diagnostic methods: physical exam and medical history. Chest X-ray or CT scan. Sputum culture. Blood tests, CBC, CRP. Pulse oximetry, oxygen levels. Treatment options: antibiotics for bacterial infections. Antivirals for viral causes. Antifungal medications. Oxygen therapy if needed. Rest, fluids, and supportive care. Prevention tips: get vaccinated, flu, pneumonia, COVID-19. Practice good hygiene, hand washing, masks. Avoid smoking and pollution. Strengthen immunity with a healthy lifestyle. Treat underlying conditions promptly.